Hello friends, now we are going to study the morphology of edema and then the clinical features. First of all, what is morphology? Means we are going to study the structure grossly as well as microscopically. What is the morphology of edema? Obviously what we see is subtle cell swelling, right? Now what are the most common site of the edema? They are subcutaneous tissue, brain and lung. Now comparative to brain and lung, the subcutaneous edema is more conspicuous. Obviously it is just below the skin, so we can observe it very easily. The subcutaneous tissue is often influenced by the gravity. What does it mean? That when we are standing, the edema appears in legs, but when we are lying down, the edema appears at the sacral region. Hence, it is known as dependent edema. Now we have a question. What is this pitting edema? When there is a subcutaneous edema and if I apply a pressure with my finger and it displaces the interstitial fluid and form a depression, then it is known as pitting edema. If it does not displace the interstitial fluid and does not form any depression, then it is known as non-pitting edema. Now let's look at another question. What is periorbital edema? It is the edema formed around the eyelids. Now it is a sign of severe renal disease, because when there is any renal disease or renal failure, edema first appears around the loose connective tissue. Now, in brain, edema can be localized or generalized, which depends on the pathological process or injury. In normal condition, gyri and sulci are of enough size, but during the edema, gyri become extended and sulci become narrowed. As brain is covered by the skull, it is a strong tissue which will not allow brain to increase in the size. Hence, it will compress the brain, and which is a very painful condition and also disturb the neuronal activities. Now, looking at pulmonary edema. During pulmonary edema, the lung becomes 2 to 3 times heavier. And on sectioning, we can observe frothy and blood-tinged fluid, which contains fluid of the edema, air and extravasated red blood cells. Now as we know, effusion is known as nothing but the edema of body cavities. When it is related to pleural cavity, it is known as hydrothorax, as lungs are present in thorax region. When it is pericardial cavity involved, it is known as hydropericardium. And when edema is involved in peritoneal cavity, it is known as hydroperitoneum or ascites. So now let's look at the clinical features of edema. Now what are the consequences of edema is all related to its clinical features. It can be just annoying to it can be rapidly fatal. When any brain or our lung is involved, it is very dangerous. Now what is the importance? It indicates underlying any cardiac disease or renal disease or hepatic disease, because when these are disturbed, there are chances of edema. When edema is quite high, it can also hamper our wound healing and clearance of infection. Now, pulmonary edema occurs mainly due to left ventricular failure, but it can also occur due to renal diseases or when there is infection or inflammation in lungs. Now, due to pulmonary edema, our gaseous exchanges get hampered, and it also creates a favorable environment for the growth of bacteria, and chances of infection increases. Now let's talk about brain edema. It is very dangerous, as we have already discussed that skull is incompressible, hence brain cannot grow in size. So it will try to herniate through the foramen magnum. And when brain tissue herniate, it can cause compression of the blood vessels supplying the brain, So immediately brain will suffer from hypoxia, and which is very dangerous, or it may injure our medullary centers, which are also essential for our life, which can lead to death. Now, what are the consequences of peritoneal effusion? It occurs due to portal hypertension, that is related to liver. So, there will be edema in the peritoneal cavity, which will cause a chance and invitation to bacterial infection, which can slowly lead to very dangerous and fatal infection. So friends, this was all about the morphology and clinical features of edema and effusion. Friends, it takes a lot of efforts to make the video. So please, if you find it useful, don't forget to subscribe and like the video, and also share it with your friends. Thank you.